Introduction. Integumentary system consists of the skin and accessory organs. Hair, nails, and cutaneous glands. Inspection of the skin, hair, and nails is significant part of a physical exam. Skin is the most vulnerable organ exposed to radiation, trauma, infection, and injurious chemicals receives more medical treatment than any other organ system. Dermatology, scientific study and medical treatment of the integumentary system. The skin and subcutaneous tissue. Expected learning outcomes. List the functions of the skin and relate them to its structure. Describe the histological structure of the epidermis, dermis, and subcutaneous tissue. Describe the normal and pathological colors that the skin can have and explain their causes. Describe the common markings of the skin. The skin and subcutaneous tissue. Skin is body's largest and heaviest organ, covers 1.5 to 2.0 m2. Composes 15% of body weight. Layers: epidermis, stratified squamous epithelium, dermis, deeper connective tissue layer, hypodermis. Connective tissue layer below dermis, not part of skin, but associated with its skin. Thickness ranges from 0.5 to 6 mm. Thick skin covers front of hands. Bottoms of feet has sweat glands, but no hair follicles or sebaceous oil glands. Epidermis 0.5 mm thick. Thin skin covers rest of the body. Possesses hair follicles, sebaceous glands, and sweat glands. Epidermis about 0.1 mm thick. Functions of the skin: resistance to trauma and infection, keratin, dermacidin, and defensins, acid mantle. Other barrier functions: water, UV radiation, harmful chemicals, vitamin D synthesis. Skin carries out first step, liver and kidneys complete process. Functions of the skin: sensation. Skin is an extensive sense organ, receptors for temperature, touch, pain, and more. Thermoregulation, thermorecepts, vasoconstriction, vasodilation, perspiration, nonverbal communication, facial expression. Importance in social acceptance and self-image. The epidermis, keratinized stratified squamous epithelium, includes dead cells at skin surface packed with tough keratin protein. Lacks blood vessels. Depends on the diffusion of nutrients from underlying connective tissue. Contains sparse nerve endings for touch and pain. Cells of the epidermis. 5 epidermal cell type: stem cells, undifferentiated cells that give rise to keratinocytes in deepest layer of epidermis, stratum basale. Keratinocytes. Great majority of epidermal cells synthesize keratin. Melanocytes synthesize pigment melanin that shields DNA from ultraviolet radiation. Occur only in stratum basale, but have branched processes that spread among keratinocytes and distribute melanin. Cells of the epidermis. Continued tactile cells, touch receptor cells associated with dermal nerve fibers. In basal layer of epidermis, dendritic cells, macrophages, originating in bone marrow that guard against pathogens. Found in stratum spinosum and granulosum. Layers of the epidermis. Thin skin contains 4 strata. Thick skin contains 5 strata. Stratum basale, deepest epidermal layer. A single layer of stem cells and keratinocytes resting on the basement membrane. Stem cells divide and give rise to keratinocytes that migrate towards skin surface to replace lost cells. Also contains a few melanocytes and tactile setons. Stranosome, several layers of keratinocytes joined together by desmosomes and tight junctions named for appearance of cells after histological preparation. Spiny also contains some dendritic cells. Layers of the epidermis. Continued stratum granulosum, 3 to 5 layers of flat keratinocytes. Cells contain dark staining keratohyalin granules. Stratum lucidum. Thin, pale layer found only in thick skin. Keratinocytes packed with clear protein. Eledin. Stratum cornum, surface layer, several layers up to 30 of dead, scaly, keratinized cells. Resists abrasion, penetration, water loss. The life history of a keratinocyte. Keratinocytes are produced by mitosis of cells in stratum basale or mitosis of keratinocytes in deepest part of stratum spinosum. Mitosis requires abundant oxygen and nutrients. So once cells migrate away from blood vessels of the dermis, mitosis cannot occur. New keratinocytes push older ones toward the surface over time. Keratinocytes flatten, produce more keratin and membrane coating vesicles. In 30 to 40 days, a keratinocyte makes its way to the skin surface and flakes off. Exfoliates as dander, slower in old age, faster in injured or stressed skin. Calluses or corns. Thick accumulations of dead keratinocytes on hands or feet. The life history of a keratinocyte. Four important events occur in stratum granulosum: keratoilin granules release filaggrin, a protein that binds keratin into tough bundles. Cells produce tough envelope proteins beneath their membranes, membrane coating vesicles. Release lipid mixture that spreads out over cell surface and waterproofs it. Keratinocytes, organelles degenerate and the cells die. Epidermal water barrier water retention is fostered by tight junctions between skin cells and the waterproofing that occurs in the stratum. Granulosome helps prevent dehydration, does not prevent the absorption of water by the stratum cornum when we soak in a bath. Prune fingers. The dermis connective tissue layer beneath epidermis ranges from 0.2 mm eyelids to 4 mm palms. Soles composed mainly of collagen, well supplied with blood vessels, sweat glands, sebaceous glands, and nerve endings. Houses hair follicles and nail roots is the tissue of the facial skin to which skeletal muscles attach and cause facial expressions of emotion. Has a wavy, conspicuous boundary with the superficial epidermis. Dermal papillae are upward, finger-like extensions of dermis. Epidermal ridges or downward waves of epidermis. Prominent waves on fingers produce friction ridges of fingerprints. The dermis papillary layer, superficial zone of dermis, thin zone of areolar tissue in and near the dermal papilla, allows for mobility of leukocytes and other defense cells. Rich in small blood vessels. Reticular layer, deeper and thicker layer of dermis consists of dense, irregular connective tissue which marks striate tears in the collagen fibers caused by stretching of the skin due to pregnancy or obesity. The hypodermis. Hypodermis subcutaneous tissue has more areolar adipose than dermis, has pads body and binds skin to underlying tissues. Common site of drug injection since it has many blood vessels. Subcutaneous fat energy reservoir. Thermal insulation thicker in women, thinner in infants. Elderly. Skin color. Melanin, most significant factor in skin color produced by melanocytes, accumulates in keratinocytes. Two forms of the pigment eumelanin, brownish black pheomelanin, reddish yellow. Sulfur containing people of different skin colors have the same number of melanocytes. Darker skinned people produce greater quantities of melanin. Melanin breaks down more slowly. Melanin granules more spread out in keratinocytes. Melanized cells seen throughout the epidermis. Lighter skinned people. Melanin clumped near keratinocyte nucleus. Little melanin seen beyond stratum basale. Skin color. Exposure to UV light stimulates melanin secretion and darkens skin. This color fades as melanin is degraded and old cells are exfoliated. Other pigments can influence skin color. Hemoglobin pigment in red blood cells adds reddish to pinkish hue to skin. Carotene. Yellow pigment acquired from egg yolks and yellow orange vegetables concentrates in stratum cornum and subcutaneous fat. Skin color. Colors of diagnostic value: cyanosis, blueness due to oxygen deficiency, erythema; redness due to increased blood flow to skin; pallor, paleness due to decreased blood flow to skin; albinism, milky white skin and blue-gray eyes due to genetic lack of melanin synthesizing enzyme; jaundice, yellowing due to bilirubin in blood, can be caused by compromised liver function; hematoma, bruising, clotted blood under skin. The evolution of skin color. Variations in skin color result from multiple evolutionary selection pressures, especially differences in exposure to UV light. UV accounts for up to 77% of skin tone variation. UV light has both harmful and beneficial effects. Adversely, it causes skin cancer, breaks down folic acid. Beneficially, it stimulates vitamin D synthesis. Populations that evolved in the tropics have well melanized skin to protect against excessive UV. The evolution of skin color. Populations that evolved in far northern and southern latitudes weak soon have light skin to allow adequate UV. Populations that evolve at high altitudes or dry climates less UV filtering also are darker skinned. Importance of vitamin D for calcium crucial for pregnancy. Lactation might explain why women are lighter skinned than men. The evolution of skin color. Other factors complicate the association between UV exposure and skin tone: migration, cultural differences in clothing and shelter, intermarriage of people of different geographic ancestries, sexual selection, a preference in mate choice for partners of light or dark complexion. Skin markings, friction ridges, markings on the fingertips that leave oily fingerprints on surfaces we touch. Everyone has a unique pattern formed during fetal development that remains unchanged throughout life. Not even identical twins have identical fingerprints. Allow manipulation of small objects. Flexion lines, flexion creases, lines on the flexor surface of the digits, palms, wrists, elbows mark sites where skin folds during flexion of joints. Skin bound to deeper tissues along these lines. Skin markings, freckles, and moles stand to black aggregations of melanocytes. Freckles flat, Melanized patches, moles never elevated. Melanized patches, often with hair moles, should be watched for changes in color, diameter, or contour that may suggest cancer hemangiomas birthmarks. Patches of discolored skin caused by benign tumors of dermal capillaries. Some disappear in childhood, others last for life. Capillary hemangiomas, cavernous hemangiomas, port wine stain. Hair and nails. Expected learning outcomes distinguish between three types of hair. Describe the histology of a hair and its follicle. Discuss some theories of the purposes served by various kinds of hair. Describe the structure and function of nails. Hair and nails, hair nails, and cutaneous glands are accessory organs appendages of the skin. Hair and nails are composed of mostly dead keratinized cells. Pliable soft keratin makes up stratum corneum of skin. Compact hard keratin makes up hair and nails. Tougher and more compact due to numerous cross linkages between keratin molecules. Hair, pilus, another name for a hair. Pili, plural of pilus, hair. A slender filament of keratinized cells growing from a tube in the skin called a hair follicle. Hair covers most of the body. Hair does not cover palm soles, palmar plantar and lateral surfaces and distal segments of fingers and toes. Lips, nipples, and parts of genitals, limbs, and trunk have 55 to 70 hairs per cm2. Face has about 10 times as many, 100,000 hairs on an average person's scalp. Differences in hairiness across individuals is mainly due to differences in texture and pigment of hair. Hair. Three types of hair: lanugo, fine, downy, unpigmented hair that appears on the fetus in the last 3 months of development; vellus, fine, pale hair that replaces lanugo by time of birth; two-thirds of the hair of women, one-tenth the hair of men; all of hair of children except eyebrows, eyelashes, and hair of the scalp; terminal, longer, coarser, and more heavily pigmented forms eyebrows, eyelashes, and the hair of the scalp after puberty. Forms the axillary and pubic hair, male facial hair, and some of the hair on the trunk and limbs. Structure of the hair and follicle. Hair is divisible into three zones along its length: bulb, a swelling at the base, where hair originates in dermis or hypodermis only; living hair cells are in or near bulb root; the remainder of the hair in the follicle shaft, the portion above the skin surface. Structure of the hair and follicle. Dermal papilla, bud of vascular connective tissue encased by bulb, only source of nutrition for hair matrix. Region of mitotically active cells immediately above papilla, hair's growth center. Structure of the hair and follicle. Three layers of the hair in cross section: medulla, core of loosely arranged cells, and air spaces. Cortex constitutes bulk of the hair. Consists of several layers of elongated keratinized cells. Cuticle composed of multiple layers of very thin, scaly cells that overlap each other. Free edges directed upward. Structure of the hair and follicle. Follicle, diagonal tube that extends into dermis and possibly hypodermis. Epithelial root, sheath extension of the epidermis lying adjacent to hair. Root widens at deep end into bulge. Source of stem cells for follicle growth. Connective tissue, root sheath derived from dermis, but a bit denser, surrounds epithelial root. Sheath, hair receptors, sensory nerve fibers entwining follicles. Pilorector muscle, erector pili. Smooth muscle attaching follicle to dermis, contracts to make hair stand on end. Goosebumps. Hair texture and color. Texture. Related to cross sectional shape of hair: straight hair is round, wavy hair is oval, curly hair is relatively flat. Color. Due to pigment granules in the cells of the cortex, brown and black hair is rich in eumelanin, red hair has high concentration of pheomelanin. Blonde hair has an intermediate amount of pheomelanin and very little eumelanin. Gray and white hair have little or no melanin. Air present in medulla. Hair growth and loss. Three stages of hair cycle: anagen, growth stage, 90% of scalp follicles at a given time. Stem cells multiply, root sheath cells above papilla form hair cells of hair matrix. Hair cells make keratin and die as they are pushed upward. Catagen, degeneration stage, mitosis in hair matrix ceases and sheath cells below bulge. Die, base of hair keratinizes into a hard club. Club hair easily pulled out by brushing. Telogen, resting stage, when papilla reaches the bulge. Hair growth and loss. We lose about 50 minus 100 hairs daily. A club hair may fall out during catagen or telogen or be pushed out in the next anagen phase in young adults. Scalp follicles spend 6 to 8 years in anagen, 2-3 weeks in catagen, 1 or 2 months in telogen. Hair growth. Scalp hairs grow 1 mm per 3 days. Alopecia, thinning of the hair or baldness. Pattern baldness. Hair lost from select regions. Baldness allele is dominant in males and expressed when testosterone levels are high. Testosterone causes terminal hair on top of scalp to be replaced by vellus hair. Hirsutism, excessive or undesirable hairiness in areas that are not usually hairy. Functions of hair. Most hair on trunk and limbs is vestigial, has little present function, but kept ancestors warm hair receptors alert us of parasites crawling. On skin, scalp retains heat and protects against sunburn. Pubic and axillary hair signify sexual maturity and aid in transmission of sexual sense. Guard hairs, vibrissa guard nostrils and ear canals, eyelashes and eyebrows, nonverbal communication. Nails, fingernails and toenails clear, hard derivatives of stratum corneum composed of thin, dead cells packed with hard keratin functions improve grooming, picking apart food. Other manipulations provide a counterforce to enhance sensitivity of fleshy fingertips to tiny objects. Nail plate. Hard part of the nail free edge overhangs the finger nail body, visible edged part attached part of nail root extends proximally under overlying skin. Nails nail fold, surrounding skin rising above nail groove, separates nail fold from nail plate nail bed. Skin underlying the nail plate hyponychium, epidermis of the nail bed nail matrix. Growth zone mitotic of thickened stratum basal at proximal end of nail 1 per week in fingernails. Slightly slower in toenails lunule. Opaque white crescent at proximal end of nail due to thickness of matrix eponychium cuticle. Narrow zone of dead skin overhanging proximal end of nail. Cutaneous glands. Expected learning outcomes. Name two types of sweat glands and describe the structure and function of each. Describe the location, structure, and function of sebaceous and ceruminous glands. Discuss the distinction between breasts and mammary glands and explain their respective functions. Sweat glands. Two kinds of sweat: pseudophorus glands apocrine and merocrine apocrine. Sweat glands locations: groin, anal region, axilla, areola. Beard area in men inactive until puberty. Ducts lead to nearby hair follicles produce sweat that is milky and contains fatty acids. Respond to stress and sexual stimulation, believed to secrete pheromones, chemicals that can influence behavior of others. Bromidrosis. Disagreeable body odor produced by bacterial action on sweat from apocrine glands. Sweat glands, continued merocrine eccrine sweat glands, most numerous skin glands. 3 to 4 million in adult skin, especially dense on palms, soles, and forehead. Simple tubular glands, watery perspiration that helps cool the body. Myoepithelial cells. Contract in response to stimulation by sympathetic nervous system and squeeze perspiration up the duct, found in both apocrine and merocrine glands. Sweat glands. Sweat begins as a protein-free filtrate of blood plasma produced by deep secretory portion of gland. Some sodium chloride and other small solutes remain in the sweat. Some sodium chloride reabsorbed by duct. Some drugs are excreted in sweat. On average, 99% water with pH range of 4 to 6. Acid mantle inhibits bacterial growth. Insensible perspiration. 500 mA does not produce visible wetness of skin. Diaphoresis. Sweating with wetness of the skin. Exercise may lose one as sweat per hour. Sebaceous glands. Sebaceous glands are flask-shaped and have short ducts opening into hair follicles. Holocrine secretion style sebum. Oily secretion of sebaceous glands keeps skin and hair from becoming dry, brittle, and cracked. Lanolin sheep sebum. Ceruminous glands. Ceruminous glands are simple coiled, tubular glands in external ear canal. Their secretion combines with sebum and dead epithelial cells to form earwax. Cerumen keeps eardrum pliable, waterproofs the canal, kills bacteria, makes guard hairs of ear sticky to help block foreign particles from entering auditory canal. Mammary glands. Mammary glands. Milk producing glands that develop only during pregnancy and lactation. Modified apocrine sweat glands, rich secretion released through ducts. Opening at nipple. Mammary ridges or milk lines. Two rows of mammary glands in most mammals. Primates kept only two glands, but a few people have additional nipples along the milk line. Polythelia. Skin disorders. Expected learning outcomes. Describe the three most common forms of skin cancer. Describe the three classes of burns and the priorities in burn treatment. Skin cancer. Skin cancer. Most cases caused by UV rays of the sun damaging skin cell DNA, most often on the head, neck, and hands. Most common in fair skinned people and the elderly. One of the most common. Easily treated cancers, has one of the highest survival rates if detected and treated early. Three types of skin cancer named for the epidermal cells in which they originate: basal cell carcinoma, squamous cell carcinoma, and malignant melanoma. Skin cancer. Basal cell carcinoma, most common type, least dangerous because it seldom metastasizes, forms from cells in stratum basale. Lesion is small, shiny bump with central depression and beaded edges. Skin cancer cell carcinoma arises from keratinocytes of stratum spinosum lesions, usually on scalp, ears, lower lip, or back of the hand, have raised, reddened, scaly appearance, later forming a concave ulcer. Chance of recovery good with early detection, and surgical removal tends to metastasize to lymph nodes and may become lethal. Skin cancer, malignant melanoma, skin cancer that arises from melanocytes, less than 5% of skin cancers. But most deadly form can be successfully removed if caught early. But if it metastasizes, it is usually fatal. Greatest risk factor: familial history of malignant melanoma, highest incidence in men, redheads, and people who had severe sunburn as a child. Burns, leading cause of accidental death, fires, kitchen spills, sunlight, ionizing radiation, strong acids or bases, or electrical shock. Deaths result primarily from fluid loss, infection, and toxic effects of fissure. Burned. Dead tissue debridement, removal of fissure, classified according to depth of tissue involvement. First degree burn involves only epidermis, redness, slight edema, and pain, heals in days. Second degree burn, partial thickness burn, involves part of dermis, may appear red, tan, or white, blistered and painful, 2 weeks to several months to heal, and may leave scars. Third degree burn, full thickness burn, involves epidermis, all dermis, and often some deeper tissues, often requires skin grafts, needs fluid replacement, infection control, supplemental nutrition. UV rays and sunscreen. UVA and UVB are improperly called tanning rays and burning rays, both thought to initiate skin cancer. No such thing as a healthy tan. Sunscreens protect you from sunburn, but unsure if they provide protection against cancer. High SPF numbers can give false sense of security. Chemical in sunscreen damage DNA and generate harmful free radicals. Skin grafts and artificial skin. Third degree burns often require skin grafts. Graft options: autograft, tissue taken from another location on the same person's body. Split skin graft, taking epidermis and part of the dermis from an undamaged area, such as the thigh or buttocks, and grafting it into the burned area. Isograft, skin from identical twin. Temporary grafts, immune system rejection. Homograft, allograft from unrelated person. Heterograft, xenograft from another species. Amnion from afterbirth, artificial skin from silicone and collagen. Thanks for watching video.